Welcome, fearfully and wonderfully made human, to the Holistic Counselor Podcast. It's me, Diana from Through the Valley Therapy. Today, I am truly excited to introduce a special guest who is not only a fellow member of our Christian mental health professionals group, but also a pioneering force in the world of psychiatry.
Mhm.
Dr. Nina Joy Mena is double board certified in general and child and adolescent psychiatry, and she serves as the chief medical officer at CRIS 180, where she offers compassionate care and works tirelessly to break the stigma surrounding mental health in the Black community. In addition to her clinical work, Dr. Mena is the founder of Enjoy Life Living in Full Empowerment LLC and the host of the Journey to Joy live podcast. She's also an author with her latest work, Enjoyable Nurturing Authentic Living, a journal and therapy companion using the Inspire Joy method, making waves in the mental health field. Dr. Mena's dedication to promoting resilience, wellness, and joy is truly inspiring. And I'm thrilled to have her here today to share her wisdom with us. So, without further ado, let's dive into our conversation with Dr. Nina Joy Mena.
Thank
Welcome.
you. Thank you. Great introduction. Appreciate
Okay.
that.
All right. So, let's just start. Can you just start by sharing your journey? Oh my goodness, into psychiatry and how you transitioned to a
Yeah.
holistic, integrative approach to mental health.
Yes. So actually, when I was young, I always wanted to be a baby doctor. And I have the story of getting hit by a car at the age of 5 and really seeing like, what do doctors do? Right. I mean, I didn't have any broken bones, thank God. But it was just like my introduction of, ooh, I want to be a doctor and I want to be a baby doctor. So when it came time to going to college and really thinking about that, I got introduced into psychology. I think I saw the movie Beautiful Mind. I think that was one of the major
Wow.
movies that really got me like,
Yes.
mental health. So then I wanted to be a baby doctor, a kid doctor. And then I'm like, what's this whole psychiatrist thing? What's a therapist? This is really cool. So as I was in medical school, I learned about the triple board program, which you can end up becoming board certified in pediatrics, adult psychiatry, and child psychiatry. So I actually
Wow.
did match in that program, but I ended up transitioning into the categorical psychiatry program because doing all of that was just way too much. And I
Yeah.
realized that I did do 18 months of pediatrics. So nice, cool, I know it. But I was like, I'm not going to sit for those boards. So
Yeah.
I ended up doing the psychiatry residency and then coming down to Emory for the child and adolescent psychiatry fellowship program. And once I graduated that, I worked for Morehouse School of Medicine and was associate assistant professor there, as well as the associate program director for their fellowship program. And then ended up leaving last year. And that's when I felt like I broke free. I loved
Mm.
Morehouse. Morehouse is great. I'm still an adjunct faculty member there. But people would talk about, well, what's your brand? Do you have a website? I'm like, what do you mean, what's my brand? Do
Yeah.
I have a website? I work for Morehouse. Go to Morehouse website. You'll see my picture there. But when I left them and I became the chief medical officer at Chris 180, I felt more free. And I says, well, let me create my own business. My name is Enjoy. So then enjoy life. Life stands for living in full empowerment. And I'm like, this is mine. This is my baby. I can do what I want. And you asked me, when did I become more holistic? As a
Yes.
psychiatrist, I feel like I've always looked at the person as their whole body, as their whole person. As
I
a mental
love
health
that.
professional, you can't help but do that because there's so
Well,
much more to the
yeah, well, girl, come on.
there's probably more to that. But I mean, I feel like there's so much more to a person than just like you walk
Yes.
into my office
Yes.
and let me throw a medication to you. And
Mm.
I'm just not a pill popper. And I tell my patients all the time, just because you see me doesn't mean you're gonna get a medication or that you
Good for
have to get a
you.
medication.
This is
Because I'm a
refreshing.
firm believer. Yeah, I'm a firm believer in therapy, therapy, therapy. And I feel
Mm,
like, research even says that if you're on a medication and you do therapy, it's that synergistic relief and improvement.
right.
So yeah, just doing my own business and starting my own practice, I felt like, let me create the Inspire Joy, create the Enjoyno, and create something that my community, not even
Yeah.
just my patients, could use
Right.
so that they're looking at all aspects of their life, not just mental health, but their physical health, mental health, financial health, spiritual health, all those things, even
Wow.
social health. So this,
Wow. Oh my goodness. Okay. So this is so refreshing, guys, because some of you, if you've listened to my past podcast, just my experience though in
interesting.
Broward County, basically that's
Uh-huh.
all I've had is this experience in South Florida. But I think working with teenagers and what I saw in psychiatry really gave me a bad taste. And to hear you speak that
Mm.
you actually do therapy and you're not a pill pusher and that you
Mm-hmm.
actually understand that the human being is a holistic, nutrition, everything.
Everything.
That is like I think you should be training other psychiatrists.
Yeah. Hey, that's the goal.
So anyway, but what's Chris 180?
Oh, yeah. Chris
Explain that.
180 is a community mental health center. So it's a huge organization in Atlanta, trauma-informed organization. We have psychiatrists, psychiatric nurse practitioners, therapists. There's 45 different programs, adoptions, foster care, violence prevention, LGBTQ plus, all kinds of programs, even some residential. So I work there, and I've actually always been a psychiatrist for them ever since I was a fellow. I did a rotation there. And so, like I said, just became a leader last year, but I love them. They're my baby.
I love that. All right. So let's just talk about holistic psychiatry a little bit
Yes.
more. Can you share a success story where holistic methods significantly impacted a patient's mental health?
Yes. My patients seem to light up when I start talking about other things because, they come in and normally the focus is on what made you feel down? What were you depressed? Why were you anxious? And, I focus on resilience. I says, well, when did you last feel resilient or when did you use your positive coping skills or your positive affirmations is what I mean, making sure they're using all those things. And, I ask them questions about running and exercise and eating. Well, I
Wow.
feel like we have to be that investigator as a psychiatrist because it's
Yes.
not just about the depression, how you feeling, did the pill make you feel better? And okay, bye. Because our circumstances, everything that we're in, the way we think, the way we behave can change that. I know you're asking for a specific success story. I can't think of a specific
No,
success
that's
story right
okay.
now,
Yeah.
but it tends to be more successful and they seem to have a better outcome when we do talk about those things than
How do you
not.
have enough time? Because I think that was one thing I saw.
Yeah.
Oh my goodness. Within the when you have to take insurance and
Yeah.
you're pushed, oh, you have to see 100 patients in a day and here's your
Oh,
10 minutes or some crazy stuff. I'm telling you right now, like
that's
maybe it's the
true.
difference between Florida and Georgia. I don't know. But
I,
do you see where I'm getting at? It's like, how
yeah.
do you take that step back? Now you're in private practice, so you have a little more. So do I. Like I have a little
Mhm.
more freedom because I'm in
Yeah.
private
Do what you
practice.
want.
But I also want to help my community, my BIPOC
Hmm.
community here locally, right?
Hmm.
Because some of them in that community mental health where I started, that's where I saw like,
Right.
what's going on here? Like, this is not
Right.
healthy. We're not asking questions. We're not investigating. We're not saying, what's your ACE score, your adverse childhood experience? We're not understanding the cultural background
Right.
that your culture is very different than the
Hmm.
norm that you've been studying. What do you say
Yeah,
about that?
you're right. Professionals and providers, we don't have enough time. And so that's a problem. But I made sure that my providers have the time at Chris 180. They
Mhm.
get 30 minutes for follow-up. You might say, well, how's that time? But 30 minutes for follow-up, 60 minutes for a new patient. And
Wow.
they have the opportunity to make a 60-minute follow-up. They make their follow-up appointments. When they see the patient, they do their follow-up. And I tell them, hey, if you need a 60-minute follow-up, do that. If you want to incorporate some therapy, do that. And I coach them on that because obviously there's different therapy add-on codes that we can use when we're doing the therapy. We should be
Right.
getting paid if we're going to do the therapy. If you don't have the time to do it, that's fine. But the reason why I say 30 minutes is a lot because we have 5 CRIS counseling centers, and when I became chief medical officer, one of the centers was doing 20-minute follow-ups and 40-minute new patients. So I said, well, no, no,
Mm.
no, we need some consistency because
Wow.
they were feeling like they didn't have enough time. And even if there's just a few questions that you ask to add in some of that brief supportive therapy, you're still getting it in when you're saying, okay, well, what strategies are you using for your depression? What does make you happy? And I always ask, how is therapy going? Because all of the patients that we see also have a therapist at Chris 180. And so
Wow.
a lot of them saying, oh, I just talk to them. I'm not really learning anything. And so I kind of coach them on, well, you got to go with a goal. Here's your goal.
Hmm.
You got to make sure you have homework because we have to make therapy work for us. I mean, like you
Yes.
said, in a private practice, I have all of the control. So,
I love that. Yeah. I
yeah.
mean, it's accountability for the client, the patient, the client, whatever you want to call them. They come in, you're giving them a service. They're paying you for a service, or their insurance company's paying you for a service. And, it's they come in, and it depends where they're at, because I'm sure, like, you being a psychiatrist, you have to see the hardcore issues
Hmm.
of, like, that come in that are super depressed.
Psychosis.
Yes,
Yeah.
psychosis, schizophrenia,
Mm-hmm.
DID, just all
Mm-hmm.
these. And so I'm sure the first is like, all right, stabilization, right?
Yeah.
Stabilizing. And then
Hmm.
trying to figure out what works or not, because that's another thing that I know, is that a lot of these medications that you have studied or I have studied, they're tested on what? They're not tested on the cultural of females or children. They're tested on,
Hmm.
and so you have to figure all that out. And then once you get them stabilized, you have them with a therapist as well, is what I'm
Right.
hearing.
Right.
Okay.
Exactly.
But with accountability and encouragement, and you're just not a number or just this other, here's the check, let's check
Yeah,
off these.
just checking them off like this is some and I saw, okay, well, I'm done.
Yeah.
Because I
Yeah.
felt that. I have the ADHD and I've probably had it throughout my childhood, but it wasn't an issue. But residency brought it out. So I went to see a psychiatrist and I could tell I was just a checkbox. He had his laptop in his hand
Yes.
and he was just checking things off, barely looked at me. And he knew I was a psychiatric resident and it was still, I experienced that. And he didn't really get to the core. He just took it as like, okay, yeah, you have your ADHD. Here's your prescription. I don't take a prescription anymore, but it was nice for me to experience that too, because it's like that's
Right.
how it is. We're a checkbox sometimes,
Yeah.
but I
I
made
had a
sure.
Right. So you teach your patients to be an advocate for themselves, then. That's what I'm
Hmm.
hearing. Instead of
Hmm.
staying in the system, do you, because you do medication management as well,
Yes.
do you help those that maybe have been in the system for a while and then they want to get off meds?
Oh yeah, I love deprescribing. My favorite patient is when they come to me and they have 6 medications, and I'm just like, oh my God, why are you on this? Let me get you off. Because some of the time they've started the meds maybe 10, 20 years ago and didn't see anyone, or the psychiatrist just kind of takes it for what it is and like, okay, that's what you need, that's what you need. But when I get them, I'm like, well, do you actually really need them? Especially if they're on two
Wow.
antipsychotics. I coach them on what that medication is doing to their body. Antipsychotics increase the risk of high blood pressure, high cholesterol, high diabetes.
Yes.
They didn't realize that. And
No.
let's try to get you off. Let's get the labs. Let's trial you off for maybe a week. Let's inch you down just a little bit, whatever the case may be for that particular patient, and sees what works. Because a lot of times they don't even need it anymore. There are patients that do require a
Right.
certain cocktail of medications, and I still try to get them off. But yeah, I definitely try to do that, and with diagnoses too. Some people have
Wow.
schizophrenia and bipolar. I'm like,
Right.
okay, I won't lock that in until I, really get to know you and understand that for you. And a lot of the times when they come to me for a bipolar diagnosis, they actually don't have bipolar.
Yeah, I've noticed that too, or borderline, or like when we go deep diving with CPTSD, which is not in the DSM, because you can't code for that.
Yeah.
But you have to think about, like, oh, this is where we have to figure out what's going to work,
Hmm.
and what's not. I'm glad to hear that. So are you
Hmm.
able to are you in Florida too? Like, if I had patients that I can send them to you?
Yes, I have a Florida license. Yes, I do.
Oh
Which is
my
why I'm on
God.
that group that you met me on.
I
Yes.
I know, but I think they were branching out, because all started in Broward. That
Oh,
group started in, and I'm talking about the Christian mental health
gotcha.
professionals. It started as Christian mental health professionals of Broward. Kayla and Anna started it, then it grew, and now it's Florida. Now it's out. I mean, it's just getting bigger and bigger.
Okay. Yes, I do have a license. So I take Aetna in Georgia, but as you
Okay.
may know, it's only state by state. So I don't have Aetna in Florida yet,
Okay.
but I
All
may
right.
look and see how that's going to go. But being
So,
by myself, I want to try one insurance at a time.
yeah, no, and I understand that. So, say somebody does want to see you, like here in
Yes.
Florida, they
Mhm.
just, place a Zoom call, and it's out of pocket. I'm taking it.
Correct.
Right.
So unfortunately,
Okay.
since it's not Medicaid on the insurance, it would be out of pocket. But they just go to my website, drenjoylife.com, and request a consultation.
Okay, I love that. All right, so let's talk about cultural competence and
Hmm.
empowerment. That's because in October they have me speaking at, and I'm telling you, I'm not a speaker, so I'm like, Lord, what are you doing? Like,
Oh, you're so good at it.
it's my first going to be speaking at like a summit for faith-based practice owners, and I'm
Oh.
I'm my what I'm teaching is on cultural competency
Oh, look at
in
you.
private practice. Yeah. And so, because a lot
Oh.
of people don't really get that. I mean, they're starting to and understanding it, but I also see, like this is people from all over the country that own a faith based private practice. And I want to challenge their thinking because, for example, I had clients that come from the Haitian population, right? Very spiritual. If
Mm-hmm.
they were raised in voodoo,
Mm-hmm.
right? They come in and they talk to someone, say a psychiatrist or a therapist that has no cultural competency. And they automatically say that guy's schizophrenic because he's talking about spirits. And it's like,
Mm-hmm.
and then boom. And then you're like a teenager and you don't know. And the parents are not from this country. They're trusting the system. And then all of a sudden, here we're on a dark road. You
Right,
see where I'm
right.
getting at? So
Yeah.
that's just one example that I will be utilizing for, to make people think because case
Mm-hmm.
study after case study. So how do you incorporate or how important is that for you?
Mm-hmm.
Like, can you talk about that a little?
Real quick, because you made me
Yeah.
think of this by giving that example. So
Mhm.
I also do trainings to therapists, teaching them how to diagnose mental illness in adults and children.
Mhm.
And one of the books I use, or the book I use, is the DSM differential diagnosis book. And they have differential diagnosis trees or decision trees for each type of symptom, right? So the
Mhm.
decision tree for hallucinations, you go down like different routes, right? It's a decision tree like almost like an algorithm. There's a certain point where it asks, are the hallucinations based in culture? And if
Mm.
the answer is yes, it says no diagnosis.
What? How do I not know that? Is that
Exactly.
new? Well, okay, this is another thing I'm going to talk to you about because I
Uh-huh.
think I think I could be real with you, right? The DSM, because I remember how angry I would get at that book when I first started back in early
Mm.
2000 because I'm looking and I'm very inquisitive and I'm like, okay, who are these people that are writing this book? And I'm looking and I'm like, who are they? Who are they? Who are they? It sounds
Hmm.
like they're a bunch of white men. No offense, white men, but but you see where I'm getting at?
Mostly incompetent sometimes. Yeah.
Well, and then all of a sudden I'm just sitting there like, yeah, well, you're not speaking to my culture or my people or my community or
Right.
whatever. And so here we are now, DSM-5. Are we on TR yet? I can't even, I don't even know because it just keeps shifting and changing. And I get it where things are new, but then at the same time, I'm a little bit of questioning like, is this
Yeah.
book being created for why? Like, why are these new
Yeah. Is it
things and other
culturally
things?
informed?
Yeah. So what do you think about that?
Yeah, so I thought it was cool that it was in there because I'm like, well, maybe it's culturally informed because we need to pay attention to that. And even when it comes to, so we alluded to trauma earlier, right? As
Mm-hmm.
far as like psychosis and bipolar, there's probably some type of trauma going on. You mentioned PTSD, and really the DSM needs to include severe PTSD, including like hallucinations of like the person who battered them. We do talk about the flashbacks or reliving the experience, but there is a part of our trauma that might lead us to some type of psychosis or anxious paranoia. And it's
Mm-hmm.
legit. Like you're hearing shotguns. I mean, that's
Yes.
that's a part of your PTSD, right? So,
Right.
there's a lot to that. There's the trauma, there's culture, spirituality, there's a lot to that. So we need to inform ourselves and think about that. And then just in thinking about what our patient might experience. I'm thinking about a patient who is a non-documented immigrant
Mm-hmm.
and thinking about, their fears of getting hospitalized because they don't have any insurance
Right.
or their fears of, what might happen if they can't get their resident card and, being able to relate to them and understand that because these are circumstances that affect their care and their treatment.
Yeah. Yeah. I mean, that makes a lot of sense. And talking about that, then they become a little paranoid. Think about
It,
that. Because
rightfully so.
right. And but if you're going to a community mental health, and I don't want to put community because they're trying to do their best with what they can and the resources they have.
Hmm.
But it at the same time, if there's like say an intern or a newbie or someone that isn't has not experienced different cultures, okay, like that to me is what's important is having them understand like we look at the world the way we are,
Yes.
right, and not how it really is.
Hmm.
And so for you, I mean, you said you teach this and the DSM has that, right? Is there any is there any like resources or anything like that that you know of that can help, say, an intern that's listening to this right
Hmm.
now?
Not any specific resources, but it's a matter of like even like your travels, traveling the world. When I was in medical school, I was able to do a lot of different international rotations. So if you're still
Wow.
a resident or you're still a student, there's
Yeah.
lots of different opportunities to do rotations out of the country. I was
Hmm.
able to do a 4-month rotation in Rwanda, 4 months in
Wow.
Bolivia, New Zealand. I did a week in Costa Rica. I was doing all of them because I love to travel. So
Hmm.
I would say travel, get out there and see, because honestly you can read all you want, but it's really the getting in there and immersing yourself, talking to
Yes.
those people, seeing Africa and realizing Africa isn't just dirt roads and giraffes and
Right.
elephants
A
walking
safari.
around. They have roads and cars and
Right.
tall buildings and things like that, because a lot of us, we grow up ignorant because that's all we know. And speaking of that ignorance, I grew
Mm.
up the opposite, right? I'm from Detroit. It was all Black people, and this might sound funny, but I legit thought that all white people were mentally retarded because the only white people in my school were in
Mhm.
special education.
Oh, wow. Wow. This is such a great different insight. See, I had I literally grew up with immigrants all around me in New York and Queens, right?
Hmm.
From all cultures. I'm saying Russia, Jamaica, China, and then my mom, she was a single immigrant mom. So I didn't have, and then I moved down to Florida, and that's the first time I really experienced hardcore racism. And I was
Mm.
like, what the freak is this? And
Yeah.
because I'm ethnically ambiguous, people did not know how to take me in any way. And most
Oh,
people thought
yeah.
I was from India, like from the Middle East.
Yep, I could
But
see
whatever.
that.
But then, and then when I start learning, I'm like, wait a minute, what's going on here? I'm not used to, but we were still multicultural, but separate.
Hmm.
The South, that
Hmm.
South mentality. But you're so right on. Like I have seen that. I have seen where people are immersed in their one culture. Say,
Yeah.
like my husband is from North Carolina. So we're totally opposite. He's a Southern white boy from North Carolina. And I go visit sometimes and
Mm-hmm.
it's a weird, they look at me weird. And I'm just like,
Mm.
okay. But I'm like, it's education, right?
Right.
That's
We
how
got to
you
get out of
learn.
our bubble. There's some people that don't leave their city. So my answer to your question is travel. Get a plane ticket.
Get a plane ticket or a bus fare if they can't afford the plane.
Well,
Or
and also people say all the time, global health is where you are. So also maybe, especially in Atlanta, maybe get out of Buckhead and go down to East Point or College, or go
right.
into the depths of Miami. So there are
Mhm.
places you can go locally to really to learn
Yes.
different cultures too. So you don't
Yes.
have to go overseas.
There's no excuse. It's really wanting to learn
Hmm.
and overcome the fear, because that's one thing I've saw
Mm.
in many different cultures. I don't care where you come from, because I've experienced and have helped many families from different cultures. And it is fear because, like I could say that there's quite a few that are like, oh, we fear the white man, or we fear this, or we fear
Hmm.
the gang member, or we fear.
Yeah.
Okay, well, you see where I'm getting at? And
Yeah.
so, or the LGBTQ, like, or stuff like
Mm.
that. And I'm just going, okay, you have to understand they're human beings with a soul. That's how I see them. And why not ask the questions? Because usually that fear is what makes you like, until you
Yeah. You're
realize
scared.
that,
You're biased.
right, you become biased. All right. So let's talk about your living in full empowerment, enjoy life.
Hmm.
What inspired that?
My name, who I am. So my daddy passed away about 3 years ago, and
Mhm.
he always says, well, you're my joy. You're my joy. I'm the reason your name is Joy. I'm the reason. So I'm just like, you know what? I got to do something that spreads the joy and shows everyone. And I would always, write enjoy on things. And I even, anytime I would take notes in my phone for my own journal, I would call it an enjoyno. And so
Ah,
I was just like, I got to get my brand out there to be seen and, enjoy life. I said, well, that has to stand for something. And just living in full empowerment, just being able to make your own decisions based on what your needs are, your
mhm.
values. I just felt like that just speaks to the joy that we all want to feel.
I love that. Okay, so tell me more though about the enjoyable, nurturing, authentic living that journal and therapy companion.
Yeah.
Because to me, this is like I'm talking to a psychiatrist who understands holistic. It's like coaching, which we're not allowed to say coaching, but we do. Because honestly, if you think about it, your education and my education, we could be coaches. Come
Oh,
on.
yeah. We could be life coaches. Yeah.
Totally. But then well, I'm not even going to go with the licensing and how
And that
ethics
would
and
get
all that.
blurry.
Yes, it gets very blurry. So I just like calling myself a psychoeducational trainer. But
Mhm.
but for
Yeah.
you, you're, you know, how do you empower your patients, and what do you do? What do you use? Are there ways that you've learned? I mean, is this, cognitive behavioral, DBT, or is this something that you
Mm,
took eclectically and picked up different things that
I love
worked for
that word.
you? I don't know if
Yeah,
did I
I
just make that
think,
up?
yeah, definitely what works for me as a
Yeah.
person, and then
Mm-hmm.
also what I've seen work and what I know as far as evidence. So the eclectic nature of all the strategies that are in this book, yes,
Mm-hmm.
I did do, but it did start with me because the five crucial areas of health in here, like I
Okay.
said before, it's the mental health, physical health, financial health, aspirational health, that's your purpose, and then
Ooh.
social health. So to me, I feel like my mental, I can get anxiety, of course, but in general, I feel like my mental health can be pretty good on a day-to-day basis. My physical health is pretty good on a day-to-day basis. Aspirational, I feel like I'm living my purpose, living my dream. So those three are pretty good, right? But
Mm-hmm.
then there's days where the financial health is just kind of poor. Or maybe that's doing fine, but then I get in a fight with my husband, and then the social health isn't doing well, and it just
Mm.
tears up my whole day. And I'm just like, life is more than just talking about my mental health. It's also
Yeah.
the social health, the financial health, and all those other things. So, we talk about this holistic thing a lot, but I says, well, I would like to create a journal that has all this here, that has a strategy that you can use to get through each of these. So I pull from cognitive behavioral health, I pull from
I love it.
dialectical behavioral health, positive psychology, mindfulness-based stress reduction,
Okay.
smart methods, the
Smart
specific,
goals.
yeah, smart goals, right? Yeah, the specific,
Yeah.
measurable, attainable,
Yes.
relevant, and timely.
Yes.
So I pull from all
Yes.
those strategies, put them in all in one book, obviously paying the respects for the people who created them.
Yes.
And so that you can know, well, what do I do when I get in this situation? But
Mm-hmm.
it's all about the positivity and our thought life, and helps you know that you can do it if you only change your thoughts and your behaviors.
Mm. How do you do that gently? Because there's some people that come in, you know that, right? And I know that because if we're that personality or those therapists or practitioners that have that, like, hey, we're coach, like encouragement and everything, and it's cat, I could tell. Like I think you and I have that same, like, yeah, come
Yeah,
on,
yeah.
like. But there's people that come in and they are not ready for that at all, and then they might feel a little, I hate to say, judged or shamed or guilty that they can't live up to the energy that's in
Oh,
the office. How would you approach that, or what do you
yeah.
do? What's the method with it? Like what would you do in that situation?
Well, it is case by case. I do have a few in my head that I think about because I do love seeing the Black woman with a severe depression, and
Mm,
they just haven't been able to be treated. I enjoy that. Come to me if that's what you have, because that's what I enjoy working with. But
okay.
it does take some motivational interviewing to get them to understand that thinking more positively can be helpful. And these are women who they've tried and tried all these coping
Yes,
skills.
yes.
It just does not work. How dare you tell me to think positively? How dare you tell me
You
to be
don't know my life.
grateful? You
Yeah.
don't know me. And look at
Yeah.
this thing that I'm experiencing, this terminal thing, or this really
Mm,
hard thing. How dare you tell me that? So it's a matter of getting onto their level. It's that motivational interviewing. What do you want in your life? And let's try it, because it doesn't hurt. And my number one thing I like to say is negative thoughts work. They will
mm,
make you feel bad, but positive thoughts work too.
right.
And you've given all your life to negative thoughts. Now it's time to switch that and give your life to positive thoughts and try it. It's going to take time. It's almost like you got to convert them the same way you would turning someone to be a Christian.
Yeah, it will, because it's uncomfortable and people don't want, especially nowadays, it's like everyone's rushing to try to be so happy and comfortable. And now look where we're at. I think that's one of the main reasons the young people, because I treat a lot of 25, I would say, to 35-year-olds now. That's what's been
Nice.
coming to me,
Oh,
right? At
okay.
25 to
Yeah,
35-year-old
yeah,
women and men. And but they're also the first generation, think about this, with social media, being raised in social media, comparison,
yeah.
and like
Mhm.
everything
Yeah,
looks a
that's almost like
certain way.
Gen Z, or maybe they're still
Yeah.
millennials. They're millennials, yeah.
Yeah, zillennials.
Uh-oh.
You have the zillennials
Ooh.
and the Gen Zs and the Gen Alpha coming up. And so I think, I mean, that's what I heard.
I
But
was wondering
anyway,
what the other one was.
yeah. But you see, I I love that you spend that time, you challenge them, you're trying to build resiliency because that's what works, especially in our population, because guess what, they can't afford all the other things. I had to come up at working in alternative schools ways to empower them even if their whole world's going chaotic around them, because what am I going to do, baker act every single
Yeah.
person or
Right.
take them to DCF or Department of Children and Families to come, or Child Protective
Mm.
Services.
Mm.
I do that when it's
Mhm.
emergency, but some of the practitioners, they are so new and they're so scared and they're so rigid that they don't go with their instincts. Do you see where I'm getting at? And
Right,
so
right.
now they're causing more trauma to the adolescents than actually sitting and trying to figure, because it's like the law and the rule. And I get it. We have to respect that to save lives.
Yeah.
But what do you think about that? Like, how do
Yeah.
you go into your instinct and, with your approaches?
Yeah, yeah. So what I wanted to mention, because I think this answers that same question. Everybody needs to read the book, The How of Happiness. It's by Sarah Lumbonsky, if I'm saying the word right. Actually, I pulled it up real quick. Leah Bomirsky, Sonia, Sonja. Anyway, The How of Happiness, the scientific approach to getting the life you want. So what she says in her book is that we actually have control over 40% of our happiness.
Wow.
Apparently 50% of our happiness has to do with this genetic set point. We all kind of go back to this certain set point that makes us happy, automatically, right? And then
Mm-hmm.
there's 10% of life circumstances that makes us happy. So apparently you got that 50% of the genetic set point, 10% of the happiness is from life circumstances, and the 40% actually has to do with how we behave and how we think.
Wow.
What?
Hmm.
So that tells me right there,
Yeah.
this is how we can convince our clients and loved ones and whoever, you got 40% to work on. And it's a matter of changing the way you think and what you do. And the fact that we sometimes try to focus on our circumstances, but I need to be married, I need to be single, I need to be
Right.
this, I need more money. That's
Right.
just 10% of your happiness.
Wow. I love that. I will put that in the show notes, including Dr. Mena's book as well, on the show notes as well. So, well, I love that. I do. I
All
really,
right.
well, and it's the science is coming in with that, the biology
Mm-hmm.
of belief. I don't know if you know Dr. Bruce Lipton, and he
Mm-mm.
studied the biology of belief, like in cells,
Oh,
in
see?
actually, yeah. And so, and understanding that genes are the bullets, the environment's the trigger. Like we have
Wow.
genes, right? You have genes. I know I have genes.
Yeah,
I know I have
yeah.
trauma genes running through
Mm-hmm.
my veins from
Mm-hmm.
whatever happened to my mom and dad and all that stuff. And it's the rewiring of the brain. It's like
Wow.
rewiring these parts, and that's what you're doing with your enjoyable journey nurture. That's what it sounds like. So tell me, you have the book in front of you. I
I
know.
do.
Okay, so tell me, when you open the book, there
Yeah.
must be a place or a space or a page because it is your book. I love that. Can you share one thing or two things from that book? Like an
Yes. So
example?
it's interesting because last week my podcast episode was all about what's inside the Enjoyno.
I
So
love that.
yeah, it's separated by basically 7 books because you mentioned the Inspire Joy method because at the
Hmm.
bottom it says I'm using the Inspire Joy
And
method.
what is that?
So what is that? Nobody's heard of it because
Yes.
I created it.
Yeah, I
So
love that. So tell me.
Inspire Inspire actually stands for integrity, nurture,
Hmm.
stability, purpose, intimacy, resilience, and empowerment. So those are 7 things. Inspire 7 letters. The integrity part of Inspire is when you think about it, that's who we are, right? Our authenticity, our mental health, our thought health, our emotional health, our ability to have the gratitude, our past traumas, whether we get through that. So then that first chapter is the integrity. So
Okay.
there's I call it thought shift, as our ability to change our thoughts from negative to positive. And it's really is what brings in the cognitive behavioral strategies. And the next one would be our emotion shift. So getting into our emotional health. All of this is under integrity. And then getting into our gratitude shifts, getting
I
into,
know.
our spiritual health. So, and there's at the beginning of each section, there's about a page or two that talks about it. Like, well, what is
Oh,
gratitude? What
good.
are our thoughts? What is CBT? What are
Yes.
thought traps? What is DBT? And then there's mindfulness moments in each beginning of each section too, because you might say like, oh, you need to do these things, but how? So I have different mindfulness moments here that tell someone how to do them. There's actually a whole
Hmm.
glossary at the end that talks about these new words, as well as 18 coping skills and strategies. So then you get
Wow.
into that next chapter, nurture, that's your physical health. So nurture is
Hmm.
your physical health. Then the other S, stability, is your financial health. And then the next one after that is the purpose. That's your aspirational health. So living your dreams of purposes. And that's when I get into the SMART goals with the financial health and the aspirational health.
Wow.
And then lastly, when I'm finishing up those five health areas, you get into the core foundations of resilience and empowerment. Because in each of those, you need resilience, you need
Mm-hmm.
empowerment. So all those
Yes.
things are fundamental. And then at the very end are the Inspire Joy daily logs. Because at the end of actually getting through these chapters, well, hey, let's put it to work.
Right.
Each day, let's talk about what we have done for to practice gratitude or to for our physical health or to our financial health. So it's really a practical way to get into those five crucial areas of your life to elevate your joy.
I love that. I mean, and especially because you bring in so many different resources
Mhm.
for the person, the reader. Do you do book clubs with this
I'm
book
about
yet?
to. I'm about to. Because, I mean, if you write a book, you can take it and do more than just be an author. Book
Yes.
clubs, I like to train therapists in this method.
I
I'd like
love
to
that.
train people who are reading it and wanting to change their into
Hmm.
joy. Yes, that is the
Like,
goal.
create a certification. Like I am certified in the enjoyable nurture or enjoy
Inspire
living
joy.
life living. Yeah, inspire.
Exactly.
I love that. That is wonderful. All right. So as we start winding down the episode, I just want to know, do you have any for listeners who are new to holistic mental health, because
Mhm.
it's sort of new, because like there's nutritional psychiatry that now is all planning on
That's
nutrition
really
and the
cool. I
and
just heard
the
those words.
yeah, and the gut, the gut microbiome and just
Mhm.
different things like that. And then you have others that are like non-pathological at all. Like they're just it's straight up. And I'm like, okay, I mean, there's different people are growing and understanding that there's just more to diagnosis and medication,
Mhm.
right?
So
I mean,
much
it
more.
has its place.
Yes.
The diagnosing has its place to help us to help, right? But it's like now we're shifting to making people stuck in it for so long and understanding that you're more than just your diagnosis
Mhm. Mhm.
and you're just more than taking med. There's other ways, right? So, what advice would you offer a beginner on their journey?
Well, everything that we're talking about is a choice. Joy
Mm,
doesn't just fall on you. You're not going to just go search for it and like all of a sudden it's there. It's a choice to choose to be joyful. Or choose joy. I don't say choose to be joyful. And then I
mm-hmm.
talk about that a lot on my podcast, Journey to Joy Live, that you can choose to enter your journey to joy. And once you choose, it doesn't mean you're automatically happy and you're automatically joyful.
Right.
It's that you're choosing to go seek a health provider or support or expert, or choosing to exercise, choosing healthy food, choosing to budget your money and make sure you're financially
Right.
secure. So that's what I believe. Because and then once you realize that you're empowered and that you can make
Mm,
the decision to do that, you can make the
yes.
decision to forgive and not hold grudges. You can make the decision to start your healing journey from your traumas. That makes you feel better. Because when you
Hmm.
externalize it and say, well, that person needs to say sorry because of what they
Right.
did. Well, that
Yes.
person, I'm always getting into, these things. And it's not victim blaming. That is not what we're talking about here. It's
No.
empowerment and
Right.
it's resilience. You can't have
Yes.
resilience without failure. So you're gonna
Exactly.
fail. You're gonna have
Yep.
the trauma. Just get
Yep.
back up and
Yeah.
choose to enter that journey to joy.
Wow. I love that. So, any final words or call to action?
Hey, just that, right? Choose
Yeah.
to enter the journey to joy because it feels better than feeling depressed. And there are a lot of people who they've been depressed for so long and that's what they're used
Yes.
to. It's their
That's all they
comfort zone. They're
know.
just like, I don't even know if I want to be happy. But
Right.
try it out. And if
Hmm.
you can't figure it out by yourself, that's what we're here for. Seek a
Right.
professional.
Yes. Yeah. Seek a professional. I will put her information because she's able to see you in Florida. Oh,
Yeah.
name all the states you're allowed to see people.
Oh, right. Well, I'm in 11 states. So
Whoa. Okay.
I mean, I
I'll
can
just
only
give
name a
you
few.
no,
At
no,
least
no. If you're in 11 states, I will put that all in the show
I
notes. That's
was
good
gonna
to
say I
know.
might miss some, but
No.
definitely Alabama, Florida, Tennessee, and
Okay.
Georgia. So
Okay.
name a few, and
Wonderful.
Michigan.
Yeah. And Michigan. No, that's great. Do you have a favorite Bible verse or anything that inspires you? for my audience that loves the Lord?
Oh, wow. Oh, gosh. I have quite a few, but the first one that comes to mind, because that's the one I have spoken to with a few patients. Do not be anxious. So that's Philippians 4:8, I believe, if
Yeah.
I'm getting it right.
Yeah,
But do,
you're in
do
it's
not
in
be anxious for anything.
anything. Yeah.
And some people might get offended by, well, how are you going to tell me not to be anxious? But that just says in and of itself, you have a choice.
Yeah, it's free
So
will.
yeah, yeah,
We
exactly.
all have free will, even though sometimes we are entrapped thinking we don't. And so it is about, it's that man's search for meaning that Viktor Frankl was talking about when he was in the Holocaust. I mean, if you read that book, that's an amazing book.
Mm.
But it's just understanding that we do have choices, we do have free will, and and we have the ability to shift just one step at a time. Like that's the
Mhm.
thing is right. Isn't that what you do with your patients? It's like, here's what I can provide for you, but it's your choice to pick it up and do something with it.
Help
I know
us
you.
help you.
I
It's a learned
Yes,
helplessness. Yeah.
yes, yeah. So anyway, I could talk to you probably forever, but I know I have
Same.
clients this afternoon and you
Same.
probably, yeah, exactly. Like we both have, but I just wanted to get you up on here so people know like there are psychiatrists because some people are very like against
Mm,
it. I'm
that's
telling you right
true.
now.
They're
No,
scared.
seriously. It is. And I understand it because I have an anger towards it as well because of what I've seen in the past, but I have to
Mhm.
shift my perspective and
Mm,
understand not to pigeonhole stereotype people or their positions, right? Because we
mhm,
could stereotype police officers. We've seen that happen. We could
mhm.
stereotype a lot of different people just
Lots of
because of
things.
our own pain or hurt or
Mhm.
what we've seen. But we have to understand that we have a bigger world out there and we need to
Right.
go look at the world and understand that we have choices, especially here in this country. Because
Exactly.
okay, and that and we hope I don't want to speak for you for Dr. Mena, but I think it's like choose joy.
Yep.
There's a way to choose joy. We can help you choose joy little by little. It's not we're going
Perfect.
to shame, and say like you need to do this. It's more of like where are you at this moment and what are you willing, what energy do you have to choose it now? How
Yeah.
can I help you?
Yeah.
Right?
Exactly. Really good.
All
Thank
right, Dr.
you.
Mina. Well, if you're ever in South Florida,
Heck
you
yeah.
let us know. Let us know. We'll all group up together, all of us down here in
Ooh,
South
love
Florida,
it.
and meet up together. Or man, I'll create an event for you down here
Hey,
somewhere
I'll do a
at
book
my church.
signing.
Yeah, or something like we'll see.
I'm
Whatever.
there. I'm hold you to it.
I love that. I love that. All right, Dr. Mina, thank you so much. And listeners, remember to trust in the Lord, guard your heart, and renew your mind. Bye.
Bye-bye.
And now for the disclaimer to make sure you understand that you are responsible for you. The content provided on the Holistic Counselor podcast is for entertainment and informational purposes only and is not intended as a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified mental health provider with any questions you may have regarding a medical or mental condition. Never disregard professional medical advice or delay seeking it because of something you have heard on this podcast. The views expressed on this podcast are my personal opinions and do not represent the views of any professional organizations with which I am affiliated. Call your doctor, 911, or 988 immediately if you have a medical emergency. The Holistic Counselor podcast does not recommend or endorse any specific tests, physicians, products, procedures, opinions, or other information that may be mentioned on the podcast. Reliance on any information provided by the Holistic Counselor podcast, guests appearing on the podcast at the invitation of the Holistic Counselor podcast, or other listeners to the podcast is solely at your own risk. Confidentiality notice. If you engage with the Holistic Counselor podcast by commenting or posting and are a client, please be aware that you may be revealing information that could compromise your confidentiality. Please remember that disclosing your identity or personal details can be linked to your clinical material. As a therapist, I am bound by confidentiality and will not respond to any disclosures of this type on this podcast. I am committed to upholding the ethics and confidentiality of the therapeutic relationship, which extends to all forms of communication in accordance with the laws and professional guidelines that govern mental health professionals. I want you to know that your privacy is of utmost importance, and you are responsible for protecting it when interacting on this platform or any other public forum. Thank you.